Let's move on to this rather serious story. The CDC is traveling to what is considered the epicenter of the Zika outbreak in Brazil, and health experts are trying to determine if the virus does indeed cause microcephaly. That's the birth defect found in newborns, and it's highly believed to have a strong connection, but they're still studying it. There is growing concern now, though, that the Zika virus could be linked to the development of serious mental illness in infected children much later in life. Dr. Susan Donelan joins me now. She's the medical director at Stony Brook University School of Medicine and assistant professor of infectious diseases. So this is an interesting twist to all of this, Dr. Donelan. Why is schizophrenia, autism, these sort of disorders even brought up in the conversation when it comes to Zika virus? What's the thinking?
Well, the thinking is that these are illnesses that are considered to be quote-unquote mental, but they have, in fact, an organic basis in brain derangements of some types. That's, in fact, one of the reasons why they may respond to chemical medications that can help balance or even eliminate some of the manifestations.
The New York Times did an interesting piece showing that children born during certain epidemics, let's say rubella, for example, or even the flu virus, if you looked later on in life, that those children, there was a higher rate of mental illness among those children. And so there's always been that question about whether or not when a mother has to fight off a certain virus, whether or not that impacts the child in utero, and then later in life they develop these illnesses. Is this specific to the Zika virus, though, or is it more of the matter of the mom having to fight off something while she's pregnant?
Well, we know that the Zika virus is considered neurotropic. That is, it has a propensity to infect cells that are associated with the nervous system. That is, particularly unfortunate. But there are certain infections, for example, influenza, that doesn't reach the nervous system, but the mom's inflammatory response can still cause damage to a fetus. So it's important to try to minimize or eliminate the opportunity for serious infections throughout the pregnancy.
And
it's not just the Zika virus.
Wouldn't it be interesting if the Zika virus is really the key to unlocking some of those mysteries, as they've been raised so many questions over the years about whether or not what happens when one is pregnant impacts the child much later in life when you think the child is born perfectly healthy. I'm just curious, with your experience in infectious diseases, the mosquitoes that carry this virus, they can only travel about 100 meters radius, so they're not able to fly, let's say, from Brazil to the United States. So what is your real concern about how the Zika virus comes here?
Well, the mosquitoes don't have to fly because we take care of that for them. People can go to an area where the local transmission is occurring, become infected, and during the time that they become infected and they recover, the virus may be in their bloodstream. Then they travel home to wherever there is another type of mosquito, and that mosquito happens to be able to transmit the infection. The mosquito bites the infected person and then goes on to bite an uninfected person. Eventually, when you get enough people that are infected and enough mosquitoes that are able to transmit the infection, it becomes more widespread.
So it's really about the people, and that could be infected, then another mosquito comes along, and we know that these mosquitoes do exist, the ones that can carry this virus in the southern part of the United States. So what do you think? What is your opinion about, especially as we're moving towards warmer months, and obviously that's when we always entertain a lot more mosquitoes, and when I say entertain, I say loosely entertain them because we don't want to. What do you advise to American families about this very unknown and very scary virus?
I think it's important to understand that a key is to maintain control of the environment so the mosquitoes don't have too many opportunities to breed. If you can control the mosquito populations, making sure that, kiddie pools are turned over and emptied, water baths for birds are changed, that type of thing, and you don't give them favorable conditions to breed, then, and you can use larvicides as well, then you can minimize the opportunity for the mosquitoes to bite an infected person and then transmit the virus or the infection to someone else who's not already infected.
It sounds like a good idea. If everyone's alert and watches some of those things, maybe we can kind of keep a handle on this before it gets too big here in the United States. Fewer than 100 cases here, all brought in from those traveling overseas, but something that we're watching. Doctor, it's great to have you in the program. Thank you so much.
Thank you for having me.